I'm Ross Luca. I'm a consultant gynecologist. I've been working in Bath for 12 years now. And my areas of specialty would be really pelvic pain, horrible periods, so heavy periods, painful periods. I'm a specialist in cervical health, so I run the cervical screening program in the colposcopy side of things in the Bath area. And we run the service looking after our endometriosis patients in the area too. Pelvic pain, particularly when they have a period, heavy periods, and that can really affect people's quality of life. And it's surprising how much we can do to help people in that situation. Not necessarily surgery, medicines and medical methods are really effective too. And pain in the pelvis, particularly around things like intercourse or going to the toilet. And again, there's plenty that we can do there. Treatment approaches really need to be individualised for the person, their symptoms, and where they are in their lives. There's no one size fits all for any of these situations. And the most important thing I can do is listen to my patients, see what they need, not just for the single symptom that they're presenting with me, but for the whole picture. When we're thinking about medicines, we're looking at ways of controlling periods, for example, not necessarily with hormones, but hormonal treatments can be really useful. And then we think about surgery, we definitely try to veer towards minimal access surgery. So keyhole surgery, also called laparoscopic surgery, where we can make our patients improve from a surgical point of view very quickly, but also recover so much quickly too. Perhaps one of the biggest areas that has changed in the last few years is looking at a certain kind of hysterectomy called a laparoscopic subtotal hysterectomy. And that's really useful for patients where we can remove large masses, fibroids, for example, from the pelvis, using only small cuts, which obviously carries a great advantage for them. And I was lucky enough to be one of the pioneers of a technique to do that safely. And so we've got a lot of experience in doing that particular kind of surgery here in Bath, and in particular at the Bath Clinic. We're seeing much more endometriosis. Endometriosis is a benign condition that's receiving a lot of attention, rightly so, in the media at the moment. Endometriosis is a condition where you get spots of the lining of the womb in the inside of the tummy, on the skin around the ovaries, for example. And that causes a lot of pain. Painful periods, painful sex, pain when opening the bowels, for example. And it's really difficult to diagnose, and often patients will see their GP a number of times before they get referred to see someone like me, a gynecologist, with an interest in that area. For most endometriosis patients, we can offer them surgery here at the clinic. The impact that our work has on our patients' lives really depends on the individual patient. There are some patients, for example, with chronic pain conditions where we may not be able to completely resolve their pains. For example, on the other end of the spectrum, one of our endometriosis patients came to me today and she was utterly pain-free. Her life was completely revolutionised by that operation. I'm absolutely thrilled for her. And again, this is all about looking at our patients and their quality of life and improving their quality of life. So fortunately in gynecology, a typical patient pathway is fairly short. A lot of the work that we do is very diagnostic in the first instance. We'll see a patient, I'll see them take a long history, and I really concentrate a lot on hearing that patient's story. An ultrasound commonly at the same time, I'll do that in the clinic with them, and then we'll come to a conclusion about the options that are available to our patients. It's very easy to concentrate on surgery when thinking about gynecological problems, but there is a significant number of patients who are going to benefit from non-surgical options. Medicines to control their periods, for example, medicines to control the cyclicity of their periods. Sometimes for patients, just having an answer is enough and know what they're dealing with and what they can expect. The Bath Clinic. I've worked at the Bath Clinic for 12 years now, and whilst I've tried working at other establishments around the area, there's only one place I come back to. Why did I specialise in gynecology? Initially, when I was a medical student, I was going to be a paediatrician. And then I had that epiphany in Stoke Hospital, as it happened, as a medical student, and I delivered the first baby that I delivered, and that was it. I was then set on a course to be an obstetrician and gynecologist. The benefit of doing gynecology is the patients, and the benefit of most of my patients, if they're young and they're fit and they have a defined problem that I'm going to look after them for.